Welcome to CPT Coding Guidelines Review, Diagnostic Studies of Cervicocerebral Arteries. Achieving accurate and complete coding is the purpose of coding guidelines. However, you can't take advantage of the benefit of having guidelines if you don't know what direction they provide. Even if you don't know the specifics of a guideline, just being aware that guidance is available for a particular situation is valuable. This series is designed to help you become better acquainted with often unfamiliar CPT guidelines for coding of significant procedures, with the intent of making you aware that the guidance exists to ultimately improve coding proficiency and boost confidence in your ability to code these procedures. The guidelines are waiting, so let's get started. Knowing something about the objective of a procedure and/or how the procedure is performed always promotes understanding of the direction given in the guidelines. This installment of CPT Coding Guidelines Review covers the guidelines for coding diagnostic studies of the cervicocerebral arteries. So, before we dive into the guidelines themselves, let's take a quick look at what diagnostic studies of the cervicocerebral arteries are. Diagnostic arterial imaging involves using radiographic procedures and techniques to obtain images of the arteries for the basis of diagnosing arterial anomalies or diseases such as blockages. One radiographic technique used to image the cervicocerebral arteries is angiography. Angiography allows for visualization of the arteries by injecting contrast into the artery so that it can be seen using fluoroscopy, which is a type of X-ray imaging that allows radiographic visualization of the vessel in real time. Cervicocerebral arteries are the arterial trunks and their branches coming into the brain from the aortic arch through the neck, namely the innominate artery, which branches into the right common carotid and the right subclavian, the left common carotid, and the left subclavian. The right and left vertebrals are branches off the subclavians. If you'd like more detailed information about diagnostic angiography, the reference shown here is a good option for an expanded overview of this procedure. A good visual of the cervicocerebral arteries can be found in CPT Appendix L, Arterial Vascular Family, Thorax and Abdomen, and Head and Neck. Diagnostic studies of the cervicocerebral arteries reported with codes 36221 to 36226 include the work of accessing the vessel, placement of catheters, injections of contrast, fluoroscopy, radiological supervision and interpretation, and closure of the arteriotomy by pressure or an arterial closure device. Codes 36221 to 36228 include arterial contrast injections with arterial, capillary, or venous phase imaging when performed. Codes 36221 to 36226 report diagnostic procedures. If an interventional procedure is performed following the diagnostic study during the same operative session, the interventional procedure is reported separately using standard coding conventions. Codes 36221 to 36226 are built on progressive hierarchies, where procedures for more intensive services are inclusive of less intensive services. When reporting codes from this range, only the code inclusive of the most intensive service provided for that vessel is reported. This means only one code from 36222 to 36224 is reported for each ipsilateral or same-sided carotid territory, and only one code from 36225 to 36226 is reported for each ipsilateral or same-sided vertebral territory. When coding for angiography of the cervicocerebral arteries, do not report codes 36222, 36223, or 36224 together for ipsilateral carotid angiography, or codes 36225 and 36226 together for ipsilateral vertebral angiography. Instead, select the code from each group that represents the most comprehensive service, based on the code hierarchies shown here, where code 36224 is more comprehensive than code 36223, which is more comprehensive than 36222, and 36226 is more comprehensive than 36225. Code 36221 is reported for non-selective placement of a catheter in the thoracic aorta with diagnostic imaging of the aorta and origins of the great vessels. 36221 is not reported with codes 36222 to 36226, as these codes for selective catheterization include the work of 36221 when performed. Add-on code 36227 reports unilateral selective arterial catheter placement and diagnostic imaging of the ipsilateral external carotid circulation. The work reported by this code includes accessing the additional vessel, placement of catheters, contrast injections, fluoroscopy, and radiological supervision and interpretation. 36227 is reported in conjunction with codes 36222, 36223, and 36224. Since 36227 is an add-on code, it would be reported as a secondary code. Add-on code 36228 reports unilateral selective arterial catheter placement and diagnostic imaging of the initial and each additional intracranial branch of the internal carotid or vertebral arteries. This includes any additional second or third order selective catheter placement in the same primary branch of the internal carotid, vertebral, or basilar artery. The work reported by this code includes accessing the additional vessel, placement of catheters, contrast injections, fluoroscopy, and radiological supervision and interpretation. 36228 is reported in conjunction with codes 36223, 36224, 36225, and 36226. Code 36228 is not reported more than twice per side, regardless of the number of additional vessels selectively catheterized. In cases where imaging is performed bilaterally in the carotid territory and/or the vertebral territory, if the same procedure or procedures are performed on both sides, codes 36222 to 36226 are reported with modifier 50. For example, performance of selective catheterization of each common carotid artery with bilateral extracranial carotid angiography is reported with code 36222 with modifier 50 appended. If the procedures represented by add-on codes 36227 and 36228 are performed bilaterally, the add-on code should be reported twice rather than with modifier 50. When different territories are studied on both sides of the body during the same session, modifier 59 is assigned to indicate that different carotid and/or vertebral arteries are being studied. For example, coding for selective right internal carotid artery catheterization accompanied by right extracranial and intracranial carotid angiography, followed by left common carotid artery catheterization with left extracranial carotid angiography, requires the assignment of two codes. 36224 is assigned for the angiography performed on the right side, and 36222 with modifier 59 appended is assigned to report the angiography performed on the left side. Codes 36218 and 75774 are add-on codes used to report selective catheterization and imaging of additional vessels beyond what is accounted for in some CPT codes. These codes are not to be assigned as part of a diagnostic study of the extra and intracranial cervicocerebral arteries. These codes may be assigned when diagnostic studies of other areas, such as the upper extremities, shoulder, or other vascular areas of the neck, are performed in conjunction with diagnostic studies of the vertebral arteries during the same session. Codes for specific types of imaging may be separately reported in conjunction with codes for diagnostic imaging of cervicocerebral arteries 36221 to 36228. Assign codes 76376 or 76377 to report 3D renderings of anatomy, and 76937 when ultrasound guidance is used to obtain vascular access to complete these procedures. Thanks for watching. Health Information Associates is committed to providing educational products that help coders to be their best. So be sure to check out the other presentations in the CPT Coding Guidelines Review series, as well as our full catalog of courses at hialearn.com.